I'm Dr. Clifton Higgins, and we're going to do a Facebook Live interview today. You've sent some questions in, and I'm going to do my best to answer them for you. First of all, how long have I been a dentist? I've been practicing dentistry for 24 years. I've actually been in this building for 22 years. I started off in Jonesboro working with another dentist, and I worked in his office for 2 years, and then I opened my solo practice. So I've been in this building on Matthews Avenue for about 22 years now. Do I have any tips on tooth whitening? Yes, I do. We have a tooth whitening system in my office, and it's called the Glow Whitening System, and it utilizes this lighted mouthpiece. That's pretty neat. It lights up and warms the material that's used to whiten your teeth, and this is about a 1-hour appointment. You go through several steps in whitening the teeth. This works really, really well. There's also a take-home system to the Glow system that you can use, but that's what we recommend is the Glow system. And we have that in this office. And you can call for pricing and appointment. We'll be glad to set you up for that. Is it really important to brush for 2 minutes? Yes, it is. It's extremely important to do that. You can brush thoroughly for 2 minutes. We recommend a Philips Sonicare brush. Those work really well, and they actually time you. You spend 30 seconds in each quadrant. So by the time you've brushed all 4 quadrants, then you will have spent 2 minutes brushing your teeth. It's very important to see your dentist every 6 months. That's critical. And I would say the best advice I could give you as far as preventing tooth decay and as far as being able to keep your gums healthy is be sure to brush twice a day for 2 minutes each time. But an important key is to floss your teeth. Before you go to bed at night, and you only have to do this once a day, before you go to bed, floss your teeth really thoroughly before you brush, because what that allows you to do is to, right before you go to bed at night, use the dental floss, go between all your teeth. It cleans out between your teeth really well. You can use your toothbrush, preferably a Philips Sonicare, to get your fluoride toothpaste between all those teeth. And by flossing first, you've opened up all the embrasure areas between your teeth, cleaned out all the food debris and bacterial plaque between there. You can do a much more thorough job of brushing. And plus, the floss is kind of an extension of your brush. You really can't get your toothbrush between all the teeth, but that floss will go right between the teeth. And a lot of times when we see tooth decay, it is right between the teeth where that dental floss needs to be going, where most people don't put it. So once a day is all you need to floss, and brush twice a day. As far as using mouthwash, it's really not a must. If you're brushing twice and flossing every day, anything else that you do is just icing on the cake and will help to prevent problems. Mouthwashes, water picks, all those kind of things, I advocate using those because they will help to keep your mouth more clean and healthy. So it's a good idea, but it's not a must. The main thing is brush twice and floss once a day. At what age should your child first go to the dentist? You should start bringing your child to the dentist around age 1. We don't really do a lot on a 1-year-old. They don't have very many teeth, but by 1-year-old they're starting to get some of those primary teeth or baby teeth in their mouth. We like to get the child used to coming to the dentist. We want to see all our kids come in happy, and if we can get them in here early and prevent any problems from becoming big problems, we can fix things while they're small. So 1-year-old's a good age to start. For sure, by the time they're 2 1/2, they have all their baby teeth, all the primary teeth are in. You want to make sure we're taking really good care of them, seeing them every 6 months. If anything crops up and they have any kind of trouble, we can fix it while it's small. One of the worst things you can see is a parent bring an 8-year-old in here that has rampant tooth decay everywhere, and then you got to do all these major procedures. The kid's not happy, the parent's unhappy, everybody's just kind of, oh wow, how'd we let this get out of hand? So it's really good to start off at an early age, and those are just kind of play visits. From the time they're 1 to about 3 or 4, you know, really not much is going to be going on, unless one big problem that we see a lot of times, parents will send their child to bed with a sippy cup or with a bottle with milk or juice or some kind of sweetened drink. They can go to bed with water and water only, because if you send that baby to bed with anything like a bottle or a juice cup that has milk or any kind of sugar beverage in there, they're going to suck on that and have that just soaking around their teeth, and it can cause what's called baby bottle caries, and that's a big, big bad problem if they have that. So we want to avoid that. So they can go to bed with water. That's about it. What toothpaste is best? Any American Dental Association approved toothpaste is going to have the proper amount of fluoride, and it's going to have proper components to clean your teeth well. So I would say if it has the ADA seal of approval, it's a good toothpaste. A lot of people have sensitive teeth, and a sensitivity toothpaste is better for them. Some of these toothpastes are very harsh and abrasive, and if you have sensitive teeth, they'll cause those symptoms to be worsened. So Sensodyne makes a really good toothpaste called Pronamel. I kind of have sensitive teeth myself, and that's the toothpaste that I use. But as far as tooth sensitivity, what causes it? Probably the most common cause of sensitive teeth is gum recession, where your gums drop down on the tooth a little bit and your roots become sensitive. There's a protective coating on that root called cementum. If you brush really, really hard, you can kind of cause the gum to sort of drop down. And part of it is, as I found in my own life, with age, our gums just recede a little bit. It happens to a lot of people. But if you brush a lot, especially with anything other than a soft bristle brush, a medium or hard bristle toothbrush will cause your gums to recede, and you brush away that cementum layer. It's not hard to do. After just a little while brushing really thoroughly, you'll brush away the cementum, and the root surface is very sensitive. That's when the sensitivity toothpaste come in handy. So that's a good key. If you have sensitive teeth, try sensitivity toothpaste. What foods are best for your teeth? Well, of course, I'm a dentist. I want to recommend stay away from sugar. Natural foods, fruits, vegetables, things like that are good. If you must eat something like a Twinkie, be sure you brush your teeth after you eat it. So any sugar substrate stuck to your teeth for a very, very long time can cause harm. It allows the bacteria that are in your mouth that cause tooth decay to stick to your tooth better and proliferate and grow and cause the byproducts to be put off that eats the hole into your enamel, which is the cavity. So something that you definitely don't want to do is take a sugary soft drink and sip on it all day long. If you have to have a soda, go ahead and down the thing and then brush your teeth. So I'm not going to tell people don't drink soda or anything sweet, but if you do that, be sure and try and cleanse your mouth, even if it's just rinsing around with water. If you can't get to a toothbrush, then use a little bit of water to rinse out your mouth after a sugary substrate is put in there, like cake or especially soft drink. Are baby teeth really important? Yes, they are. The primary teeth actually make sure that all the space is maintained in the child's mouth until the adult teeth are ready to come in. If you prematurely lose a baby teeth, things start to happen and go wrong. Teeth shift, they drift, they move around, and what can happen is your permanent teeth can be blocked out, and it can make it very hard to erupt them. And a lot of those things are even hard to correct with braces. So it's really good to make sure that you bring your child to see the dentist, and we keep those primary teeth good and healthy until they're ready to be exfoliated, until they're ready to come out on their own. I've been asked the question about how could you change the shape of your teeth. Well, one thing that you can do is you can see an orthodontist if your teeth are malpositioned, if they're rotated or out of position. An orthodontist can put braces on your teeth and change the position of your teeth. Something else that can be done is you can have the teeth reshaped and smooth. We do that a lot on teenagers. We have kids come in and they have their adult dentition in there, and there's something called mamelons. They look like little bumps on the edges of their front teeth. That's really common. As a matter of fact, I had very prominent mamelons, and we can go in and smooth those down. That enamel is very thick, and it's very simple to go in and reshape and smooth those edges of those teeth and make them look very smooth and even. As a matter of fact, my 14-year-old son was in here last week, and we smoothed his, because kids don't like that. It doesn't look right. It's something that's really noticeable, and things like that we like to take care of. And you don't even have to be numb for it. Another thing that can be done if you have really, really severe and noticeable problems as far as broken teeth or teeth that are way out of position, you can have full mouth reconstruction, where we go in and we just crown everything, or just the front teeth can be crowned. We can go in and reshape the teeth by putting permanent crowns on them that are nice, pretty white color, and they're all perfectly shaped and symmetrical. So those are things we can do to reshape the teeth. How often should I visit the dentist? We recommend every 6 months minimum. You should definitely go to the dentist every 6 months. The reason we like to do that is plaque builds up on your teeth. No matter how hard you work, you can brush and floss every day, and after about 6 months we found that it's been scientifically shown that you're going to have a certain amount of plaque buildup on there that you just can't get off at home. So the dentist can get that off. Plus, we like to look for cavities. If we can catch it within a 6-month period, usually it's going to be really small, and the small filling can fix your problem, rather than getting into something extensive like root canals, crowns, and big procedures that cost a lot of money. We like to fix things when they're small and easy to fix. What can I do to improve my dental health? Well, we've kind of gone over a lot of that. Be sure you see your dentist every 6 months. Be sure you're brushing and flossing at home like you should. If you ever have anything unusual, especially like sores in your mouth or anything that burning sensation or something just doesn't look right, doesn't feel right to you, be sure and let your dentist know that. Things like oral cancer are something that we don't see very often, but we do see at times. So it's really good if you see any kind of unusual look, appearance to your gums, tongue, cheeks, floor of your mouth, anything like that, that you let your dentist know about that. And last but not least, I've been asked, am I a Star Wars fan? Absolutely. I've seen the Star Wars trilogy multiple times, and the prequel, I don't know how many times. I've got 6 kids, so it seems like it's always on at my house. And we just went to see Solo this past weekend. All right, in closing, I'd just like to say I appreciate you dropping in on our Facebook interview today. We also have an Instagram account. You can look us up on that too. And I would also like to say that if there's anything that we can do at Higgins Family Dentistry to help you, be sure and give us a call. We'd love to treat you and your whole family. And until I see you, may the force be with you.